Good morning. Thanks for watching Living Local. I'm here chatting with Linda. We're at AIM Acupuncture and Integrative Medicine in North Myrtle Beach, and I just love hanging out with you guys now. I feel like I'm here all the time just chatting with folks. So Linda, you were telling me about what you're here for, and I won't try to repeat the words because they're very long and complicated. So can you kind of explain to me what you were saying?
Occipital neuralgia and trigeminal neuralgia. I know it's like a nerve that goes up both sides of the back of your head. Yeah.
So this is just secluded to your head and face.
Yeah, and my neck, because I have several discs that are a little out of whack.
Yeah. So this is neuralgia. So normally we talk about neuropathy and fibromyalgia here, but this is something different. So I'm very interested to learn about this. What does she have going on? What is neuralgia?
Well, neuralgia, you had asked me before we started this, how's that different from neuropathy, or is it the same thing? Because it sounds the same, but it sounds similar, same. Neuropathy is a degradation of the nerves, and neuralgia is more of an inflammation of the nerves. They're not dying, they're screaming at you. They're not happy. Neuralgia is actually really hard to treat for most common ways of treating pain. It's just non-responsive. We also see trigeminal neuralgia with the face pain. Cervical neuralgia, Linda.
Is it limited to kind of like the upper part?
It's not limited to that, but I see that more frequently.
More often?
Yeah, it's not limited to that. Anywhere you have nerves, you can have neuralgia.
Interesting.
Right?
Okay.
I remember one Christmas, probably 3 Christmases ago, when we drove down here from Pennsylvania.
Yeah.
Till we got here, I thought I was gonna die. Yeah, because it gets in my like shoulder blades and it hurts. Yeah.
And is it like a sharpness?
Yeah.
What kind of pain is that?
Yeah, it's sharp. Yeah.
Okay.
And what goes up into your head is sharp, and the trigeminal in the face is it's like a really bad toothache, but it's more everywhere.
Oh.
Yeah.
And we all know toothaches are the worst.
Right.
Oh my gosh, that sounds horrible. And is it constant pain, or does it kind of come in waves?
It comes in waves.
Okay.
Yeah. The back pain, when it starts, is usually there. Once it starts, it takes a while for it. I used a heating pad and just, pills.
Oh my goodness. Sounds horrible.
But I've been here almost a year. But no, I like it. I'm on more maintenance.
Okay.
And I come more often if I need to.
Sure.
And last when I can, like I'm here twice a week for 3 weeks now, and then we'll kind of skinny it down. But
yeah. Is her treatment plan different from like a neuropathy or fibromyalgia?
Of course, her treatment plan is much different. And we've had this conversation, every patient is a little different.
Yeah.
With neuropathy, it's a little bit more standardized based on their test scores. With neuralgia, it's not as standardized. We started off much more tightly spaced together, and we've gotten her down to, I see her relatively infrequently now.
Okay.
And she travels a lot, and she's
in
and out of
she
town.
lives in, both here and Pennsylvania.
Right.
So she's back and forth a lot. And she said that you guys are great about kind of giving her, so, if she's about to leave for a while, she sees you, maybe once or twice more than she normally would.
Yeah,
and then
a little like boost to go off and live her life. And then she comes back, and we get her fixed up, and she goes and does her beach life, and then she runs off and does her other life. And this is what we want for our patients.
Yes.
We want you to live your life, whatever that looks like. That's what we want to help facilitate.
I love it. So, tell me about your progression then. So, from when you came in until now, what's changed for you?
Just things that I can do without hurting. I golf more with my husband, not a lot, because I'm not really a super golfer. But, in general, I sew a lot more now because I love to do crafts.
So, for people that are kind of on the fence, or they're not sure whether to give acupuncture a try, what would you tell them?
I'd tell them it works and it doesn't hurt. Those needles,
I know they look scary, right?
They look scary. You don't even feel them putting them in.
What would you say about Dr. Weber?
Oh my gosh, I love her.
Yeah.
I love everybody here. They're just so nice. You couldn't have a better staff or doctor. It's very relaxed but professional, and they care about you.
Yeah. Well, thanks for joining us for Living Local. We'll see you next time.